noticed that we have another Dr. Efron, who's part of the Miller Coulson Academy of Clinical Excellence. He also happens to be a surgeon. Does he have any relation to you?
Yes, he does. He is my brother. David has been at Hopkins for longer than I have. He trained here as a surgical resident, and he was obviously one of the reasons I came to Hopkins 10 years ago. It's been wonderful having him as not only as a colleague and someone that we work together in the operating room on many different cases, but also just having your brother around to have a cup of coffee or lunch when you have time is great. We both value clinical excellence to a very high degree, and our father was a surgeon who was also a professor at Hopkins. He's instilled in us not only our work ethic, but a high degree of responsibility for providing the best quality care that we can do.
You place great emphasis on being fully present for your patients and minimizing outside distractions. Why is it so important that you give your patients your full attention?
It is, I think, especially in this day and age, it is really important that we focus when we have to focus on what we have to focus in. We are very used to using these devices.
Sure.
And having constant distractions and trying to multitask throughout the entire day. Whether you're recreating at home, watching TV or the internet, or here at work at a meeting. When we're in the room with the patient, the patient really deserves our complete attention. And the one thing my dad has always said to me and my brothers, he's a saying that actually I used during my thank you speech at the Miller Coulson Academy when I got inducted, was he's always told us to do today's work well and tomorrow will take care of itself. And what that means to me with respect to patient care is focus on what you are doing in that moment. If you focus on what you're doing in that moment, whether it's in the operating room or engaged with them in the clinic, the subsequent care will take care of itself because you'll be taking care of it when you're focusing on that. And I emphasize that in the operating room because sometimes we operate for long periods of time, 4 to 6 hours. To try and multitask while you're focusing on what you're doing leads to errors. As we all know, medical errors is one of the biggest, if not the biggest, cause for morbidity and mortality in patients. Just by focusing on what we need to focus on at the time we're focusing on it, I think we reduce that risk and we provide better care. So it is very important to me.
Dr. Efron, thanks very much for your time.
Thank you very much. Pleasure talking to you all.
That was a CLOSLER Look.
Thank you.